Good afternoon. I'm Anita Huberman. I'm CEO of the Surrey Board of Trade. Thank you for digitally attending today's town hall in Surrey, featuring Adrian Dix and Dr. Victoria Lee, President and CEO of the Fraser Health Authority. Today's event is in partnership with the South Asian Business Association of BC. I'd like to acknowledge that we are on the unceded territory of the Coast Salish people, specifically the Kwantlen, Katzie, Semiahmoo, and Tawasin First Nations. Events like this simply would not take place without the support of great community sponsors. Our community sponsor for this event is Live Well Exercise Clinic. Live Well is an ultra private gym that helps you sleep better, improves your blood pressure, and gives you more energy so you can live life to the fullest and feel young again. Their team of clinical exercise physiologists ensures that your exercise program is safe and effective. Even during this pandemic, we need to ensure that we are exercising. I would also like to thank the Port of Vancouver for their ongoing sponsorship of our Surrey Digital Town Halls since the pandemic began in the middle of March. Thank you to our Business and International Trade Center sponsors right here at the Surrey Board of Trade, BDC, the Business Development Bank of Canada, the law firm of Fasken, and the Chambers of Commerce Group Insurance Plan, represented by S&F Benefits. I'd like to recognize some government officials that are joining us on the call today. In addition to Adrian Dix, who I will introduce shortly, our MLA for Surrey is Harry Baines, and City of Surrey Councillor Linda Annis. Thank you so much for joining us, Harry and Linda. Just some instructions before we begin. All attendees are muted. If you have a question, please put it in the chat function of the Zoom technology. I will get to it as soon as we enter the question period. If I'm unable to get an answer for your question, we will get it for you after the session is over. I want to make sure that you understand that the Surrey Board of Trade, we are Surrey City Building Business Organization. During this pandemic, we have British Columbia's only pandemic rapid response business center to be that instigator of change at the different levels of government, to be that concierge of connections. And the South Asian Business Association, just an ongoing partner of the Surrey Board of Trade, is a great advocate for our city. Ladies and gentlemen, to say a few words from the South Asian Business Association, please help me welcome Paneet Sendar. Paneet, over to you.
Thank you so much. As I just logged in, our power went off and I was scrambling to get back. So I think we just made it in time. That's a good sign. I'd like to start off, of course, by thanking Minister Dix and Dr. Victoria Lee for their unrelenting efforts dealing with this pandemic. Minister Dix, you and I may have lots of political opposing views, but I do appreciate all the hard work that you're doing. And I know you'll agree when I say that your staff and the frontline health workers have done an amazing work battling the worst public health challenge, I would say, that any of us have ever experienced. We owe them a deep debt of gratitude and for all that they have done for us. The South Asian Business Association, apart from being an organization that represents the interests of South Asian businesses, it also works very actively to share information and raise awareness amongst our members. And not just amongst our members, but also the larger South Asian community. And so over the last several months, we've hosted many webinars with health professionals, elected officials, and community leaders, just to ensure that the information related to the restrictions, information related to the response, and the work done to support people and businesses reaches the community. And we really look forward to continuing to be your partners so that all of us are taking the necessary precautions to not only protect ourselves, but our loved ones, our businesses, and above all, the essential workers who are getting us through this difficult time. So thank you once again, and over to you, Anita.
Thank you so much, Paneet. And I'm going to forego formal introductions because there's so many questions for both Adrian and Victoria. But over to you, Adrian Dix, for your remarks.
I think we're all learning to unmute before we speak now, which is in the nature of these events. And I'm here where I am, also on the territory of the Coast Salish people, and in East Vancouver, in my living room in Collingwood, which is an unusual way to address the Surrey Board of Trade. I don't want to talk for too long because we want to get to the questions for Dr. Lee and I, but I want to say a few things about where we are right now in the pandemic and where we've been, because and to really echo what Puneet just said about our frontline workers and about the Fraser Health Authority and the Vancouver Coastal Health Authority. Just want to put it in context because our goals in this pandemic, of course, have been to limit, first of all, the impact of the pandemic on the most vulnerable, who are sometimes can be defined in socioeconomic terms, sometimes can be defined in terms of having chronic disease, but have largely in the pandemic been our elders. And that's important to everybody in the community. So that's the first thing. And the second thing has been overall to limit disruption, because we know the pandemic, we know this from March and April and May and June and so on, has had profound effects on other parts of our lives. So we want to limit the impact of the pandemic on things such as the overdose crisis, which is significant, and on which the Surrey Board of Trade has been a real leader, to limit the impact on our children, because we know that the closing of in-class education from March to June had a profound impact on them. And finally, to make sure that our healthcare system can deal with all of the other issues and wouldn't be overrun. And so over time, I just want to say how well our frontline workers have done up to now. BC, if you look at the 27 jurisdictions in North America with over 5 million population, has by far the lowest mortality rate from COVID-19. Just to put that in context, we're in first place. The second place jurisdiction, which is Ontario, has a mortality rate 4 times higher than ours. And that reflects the work done in our hospitals and our long-term care homes, the work done in the Fraser Health Authority, that work led by Dr. Lee, which she'll talk about in a moment. And that continues to be true in the second wave, lowest in October, lowest in November. That shows our health system responding. And in fact, our healthcare system is 100% all in. We added, as you know, in August and September, $1.6 billion. And that is a lot of money, but it reflects a lot of effort. So in British Columbia, unlike other jurisdictions, we've added hundreds, indeed, now close to 700 contact tracers to help limit transmission and to support people when they're diagnosed positive for COVID-19, which is very important, and those who've been in contact with them. We've done in September and in October and so far in November record numbers of surgeries. We've added this year more than 700,000 doses. We've acquired 700,000 more doses of influenza vaccine, and our pharmacists to date, as of November 11th, had given 280,000 more doses. Many of them are members of the Surrey Board of Trade. Just to put that in context, my phone is ringing. It's my living room. It's what happens. Just to put all those things in context, and the people working in long-term care objectively while facing extraordinary challenges. 45 current outbreaks right now in long-term care in our province have done, I think, an exceptional job, but we're challenged right now. You know this, and I know this. You also know that Surrey is kind of ground zero for that challenge. Of all of our cases, active cases in BC, and there are about 6,282 of those, about 3/4 of them are in the Fraser Health Authority right now, and the largest share of those are in Surrey. And that compares to, over the period of the pandemic, about 61%. So the Fraser Health Authority right now is been the center of transmission of COVID-19. And that action in the community what's going on in the community can have impacts on our healthcare system, on our schools, and everything else. So we have to take some steps now. And you'll know that on November 9th, Dr. Bonnie Henry put in place a series of provincial health orders. And the Surrey Board of Trade, the South Asian Business Association have been leaders in letting and leading the community through what's been a difficult time. So what are those orders? Why are they important? They're important because they reflect our detailed case management and contact tracing. They were put in place for a reason, and that reason is science. So that means we've seen significant transmission in private homes. So we're limiting it. It means that there cannot be coming together of people, occasions of people, dinner or anything else for people in their private homes right now, outside of those that live in the home in Fraser Health and in Vancouver Coastal Health. It's critically important because that's where we saw transmission. We saw specific action taken on group physical activities indoors. Why? Because we've seen, and Surrey has seen, let's face it, and we've seen it in the news, significant transmission in those settings. Weddings and funerals. We have seen, especially in the Thanksgiving weekend and thereafter, a series of weddings with very significant transmission. It's why people can continue to get married, continue to have the ceremonies, but it's at the events around those weddings where we saw transmission, and equally for celebrations of life and for funerals. These steps are important and just as important. And this is where I'm very appreciative to the Surrey Board of Trade, is that businesses have to step up their COVID-19 safety plans now, have to upgrade them, have to ensure, especially in areas where people are interacting with the public, that people wear masks, ensure that daily health checks take place. This is critically important. And finally, that we travel less, that our traveling be limited to essential travel as much as possible. There are other measures, of course, but those are critical. And why is that the case? It's the case so we can continue to serve and ensure that our acute care hospitals are not overrun, continue to protect people living in long-term care, and continue to protect the community from the long-term effects of COVID-19. There is hope here. This period is the most serious we've seen. The second wave, which is affecting the entire world, is affecting us. And Fraser Health in BC is at the center of that. So we need to take these steps now, and we need to communicate that now. But there is hope. We've seen that with respect to developments around vaccines that Dr. Lee can comment on, but which indicate to us that in the first quarter of 2021, we'll see the first supplies, not for everyone, but for some people in BC, of vaccines, and that's important. And there's hope because of the work, I think, of communities, of our coming together. We flattened the curve before, and we can do it again, but we need to act, and we need to act now. So I'm going to leave it there. Ordinarily, if I was talking to the Surrey Board of Trade, Anita, I'd talk about the second hospital we're building in Surrey, the second cancer center we're building in Surrey, the new long-term care home we're doing it with your member PICS in Surrey, the new medical school in Surrey. Surrey is going to be at the center of everything we do in healthcare over the next 4 or 5 years. It's going to be transformative and build opportunity. But right now we're in a pandemic. We have to deal with that now. And there is a role for every business, every person listening, the whole community to do that, to join with a health system that has never been more important. Public health has never been more important than it is now. Our public healthcare system, never more important. I'm proud of the work it's doing, but we all have to be part of the solution right now. And I thank you for the opportunity to speak today.
Thank you so much, Adrian. And when we're talking about everyone that needs to be a part of the solution, I'd just like to recognize some additional political representatives. Our City of Surrey councillors, Brenda Locke and Stephen Pettigrew, have joined us as well. And a very unique collaboration between government, business, and healthcare during this pandemic in order to ensure that we do not face another economic shutdown. It's my pleasure to introduce the President and CEO of Fraser Health, Dr. Victoria Lee. Victoria.
Thank you so much, and thank you, Minister, for those comments. I am also joining you in the unceded and shared territories of Coast Salish people here in Fraser Health. I'd like to start by acknowledging some of the areas that Minister Dix has mentioned. British Columbia has been applauded both nationally, internationally for our preparedness, our response and recovery efforts when it comes to COVID-19. And I think a huge part of it is the leadership provided by Minister Dix and Dr. Henry, as well as all of the work and efforts that have gone in from frontline healthcare workers, but also our communities and business partners being a big component of that. And would like to acknowledge the City of Surrey. They've been a wonderful partner for Fraser Health in our response, as well as Anita, Surrey Board of Trade. It's been wonderful to work together in terms of our response as well as communication to date. I will speak just briefly on what we're seeing and what we're asking businesses to do specifically. So in terms of what we're seeing in our Fraser Health region, we're seeing alarming and very concerning increase of number of cases in COVID-19. And we have been seeing that for a number of weeks now. As mentioned by Minister Dix, many of the events are starting with private gatherings where there's community transition and then spillover effects of those cases into schools where there are exposures. And then there are spillover impacts to work sites and then also in vulnerable settings like healthcare. We have produced some infographics that you may have seen where a single case in a fitness facility or a single case at a work site can lead to devastating impacts, even though the intent of the people that attended those areas may have been well-intentioned or completely benign. For instance, a wedding event or a symptomatic person in a fitness center can lead to hundreds of people that need to be isolated, impacting our businesses, workplaces, and schools, as well as exposures in schools or long-term care facilities in our hospitals, as well as, of course, businesses that are impacted. And I think one of the infographics talk about the variety and diversity of businesses that are impacted from, I think, lumber to manufacturing to car dealership and other quite a large number of areas. And that's what's really worrisome in terms of what we're seeing. It's not isolated in a specific area. We're seeing quite a variety of areas that are impacted. And specifically in Fraser Health region, we're seeing quite a number of clusters in the areas of manufacturing, in the areas of food processing facilities, and in the areas fitness centers, gyms, and growing number of cases in restaurants and pubs as well. And when we look at all of those cases, there are a few things that we notice. So we are asking all businesses right now to take 3 actions. The first area is to look at your COVID-19 plan, pause, re-examine in terms of how robust your COVID-19 plan is, and also take a very specific look at break rooms, lunch times, and social interactions outside and inside of workplace. So have a look at your a COVID safety plan, re-examine them from that perspective, and ensure that they're being applied. Because in some instances, we see that business places have wonderful COVID-19 safety plans, but they're not applied with the rigor that we need to see. So that's our number 1 request for all businesses. The second area that we're focusing on is more vulnerable areas. And vulnerable work sites might be because of the kind of work that you do, whether it's food processing plants, or it might be because of the types of people that work in those settings, whether they're socially disadvantaged, don't have the protection to stay home if they're ill. So whatever that might be, we're also working with WorkSafe BC and municipal bylaw officers and our own health protection services to ensure that in those vulnerable settings, we do more proactive work in terms of going in to do preventive audits and training of those facilities. So there'll be more work underway in that specific area. And third ask that we have with businesses is to work with your employees to have consent or get consent and be more proactive in terms of our contact tracing work. I know that in the past, there's been requests from businesses for us to work closely together in contact tracing. And in the past, there's been some hesitancy in doing so because of privacy concerns. But we are proactively asking employees if they're willing to give their consent to work with work sites and businesses and their employer. And we have heard from you also that it would be immensely helpful if we're willing to partner in that area. So those are the specific areas that Fraser Health is asking our business community to work together. And again, I think this is an opportunity for us to talk about why those things are important, especially right now, and why in terms of what Minister Dix has mentioned, we're at a critical stage right now. The public health orders that have been in place are based on evidence that we have seen to date, and for us to impact change that will change the path that we're currently on, we need all of your help and support in order to do so. And I think, again, this is a wonderful opportunity for us to dialogue with you on any questions or concerns that you might have, and more than happy to partner and also applaud the work that businesses have been doing in developing those excellent COVID-19 plans. We just need to take a pause, revisit, and enhance even more than what we have in place.
Thank you so much, Victoria. And ladies and gentlemen, if you do have a question, please put it in the chat function of the Zoom technology, and I will get to it as soon as I can. There were many questions that were submitted in advance. And Victoria, the first question is to you, and it's about how many cases, how many COVID deaths as well are in Surrey in total as of today? Do you know?
Oh, I don't have that specific number in front of me for Surrey. And we do report on local health service area. And for Surrey, it's divided into two local health service areas. So there's Surrey, most of Surrey, and then South Surrey and White Rock are reported together. And there's been very good reasons why we don't report by municipal level, because of the number of cases and sometimes stigma that it can lead, as well as some privacy concerns. But I think right now, provincially, we're reporting at that local health service area. What we can say about the number of cases in Surrey is that since right before wave 2, we started to see quite a significant increase in number of cases. And in the Surrey local health service area, there are significant number of cases that are active, and the largest proportion of cases in terms of municipalities and local health service areas.
And Anita, just to say that you'll see on the BC CDC website, we report with a little bit of delay on what's called a local health area, as Dr. Lee has said, which is a more precise area, but we report every week, every Thursday, by health service delivery area. And so it's available there on the BC CDC website, and we can share that, those links with members perhaps afterwards, or we'll have some people follow up with you so you can see that and see as that develops. But what's clear, if you look at active cases, as I said, it's around 75% of active cases in Fraser Health. Over the course of the pandemic, that was about 61%. It should be said that if you look at overall people who've passed away from COVID-19, it's actually, Fraser Health is not leading the province. About under half of the people who've passed away from COVID-19 live in Fraser Health, which indicates two things. One, I think the excellent performance of the authority, if you look at the overall numbers, but also the fact that in general, Fraser Health is younger than other health authorities. People in Fraser Health, the people who get and who are tested positive for Fraser Health, are younger in the Fraser Health Authority and in Surrey. Right now, the largest share of people, if you look at local health area or health service delivery area with COVID-19, are in Surrey. Of the plurality of them would be in Surrey, the largest number. And that's something that Surrey is dealing with. And I think what's changed in the last 3 weeks when I talk to people in Surrey, which I do every day, is that increasingly people I talk to know somebody who has COVID-19, who's been diagnosed with COVID-19, who's recovered from COVID-19, or is dealing with the effects of it. And that's a real change over the previous period where many of us didn't know anyone in particular, any person.
Adrian, what is your perspective on when or if the BC government will pull the plug and close schools again? What is the threshold from your perspective?
I think what we've seen, what we did, I think, after the first wave of COVID-19 in the spring and early summer was learn the lessons of that period. And there were significant lessons. And one of the lessons was, in fact, we asked British Columbians, and about 300,000 of them responded to a survey that we did about the impact of COVID-19 on them. And one of the most profound impacts, of course, is the closure of schools, which has a deep impact on our whole society. So what are we finding now? What's happening in schools now? Because everyone in Surrey knows that an outbreak was declared at Cambridge School. An outbreak was declared at a school in Kelowna, L'École Insausable in Kelowna, that there have been actions taken at a school in Delta, which would affect people as well, and in Westminster, at an independent school in Westminster. But what we're seeing now, and what we see, is a low level of transmission of COVID-19 in schools. But, and this is true in healthcare facilities as well, where actions have had a very positive effect. And I think our teachers and our administrators, I think Jordan Tinney and the administrators of the Surrey School Board, for example, done just an excellent job. So there's less transmission there. So just keep that in context, because people often say, well, close the school as if that will end transmission amongst young people. But of course, that's not the case. In fact, we're seeing less transmission within the schools because of the measures taken. But what we are seeing is more transmission in the community. We have, for example, 50,000 people who work in long-term care in BC. And if you got a lot of transmission in the community, that's going to affect them. It just is, right? So the short answer is it's our strong intention to keep schools open, right? To keep schools open, because it makes sense in terms of our whole community and the positive impacts that schools have. And we are not seeing a high level of transmission in schools. But what that also says is, if we're going to achieve these goals, making sure we reduce outbreaks in long-term care, keeping surgeries going in our hospitals. And we did a record number of surgeries in a pandemic in October. Wow, right? So, if we're going to do that, achieve these goals, we've got to take these other steps together. We've got to reduce transmission in the community together, because at a certain point, there's not a lot of transmission in schools, but the fact of large-scale community transmission will make it very, very difficult for us to maintain the level of care we're providing for other things in healthcare system and in the education system as well. So there is no number. There's no number, if that's the question of the question. But that has to be one of our goals, which is to keep these important institutions in society opening, schools and businesses and hospitals and healthcare. And that's why we have to all work together to reduce transmission. It's in the community where we're going to do that.
Adrian, just another question related to schools. The context is we have the largest school district within British Columbia. A third of our population in Surrey, as you know, is under the age of 19. Many of our kids, they go to schools in portables. Do the portables have the hand washing facilities, the pieces, the infrastructure that's needed to keep our kids safe and to adhere to health and safety protocols? What's your perspective on that?
Surrey is the largest everything, right? The largest school district and the fastest growing community, the most young people. So everything is more significant in Surrey. And I think that, and that's why I want to put it all in context, right? Because often I think when people point to Surrey in an issue, on a particular issue, including this one, they're pointing at it in a less than positive way. This is a fantastic place and the most vibrant and energetic place in the province. And yes, there's been, and my colleague Harry Baines is on the line, he can speak about this to a larger extent. We need to build here, and we are building schools everywhere. That's the practical reality. And that's why we're building a second hospital here, because the community is growing. I think that the Surrey School District is doing a very good job in its COVID safety plan, but its challenge is the greatest. I think you're right to say it. Its challenge is the most significant of any school district in the province because community transmission here is high, and because there are simply a lot of students, and we have to build almost nonstop school infrastructure to make schools better here in Surrey, and that's what we're doing. So I think that the steps being taken are the right steps. There's an extraordinary amount of money being invested in those steps. And I think Mr. Tinney, but also all of the people working in our schools, our teachers, are doing an extraordinary job. You know, there's a lot of talk about these issues, but on the ground, our administrators, our teachers, our support workers in education, working with Fraser Health, are doing extraordinary work, and I'm very proud of them.
Thank you, Adrian. Victoria, over to you. Can you speak to why Surrey's population is disproportionately affected when compared to the rest of British Columbia? What is happening in Surrey that's causing such a massive spread of the virus?
And I'll tie that into the question that you asked earlier, because I do have the data on Surrey local health area, which was cumulatively, we've had 3,993 cases per 100,000. And for South Surrey, White Rock, it was 298 per 100,000. So that's quite a large number compared to other jurisdictions in terms of local health areas. And why are we seeing a disproportionate increase in Surrey and impact in Surrey? I think that's an excellent question, and we've looked at that quite a bit from our perspective. So I think there are a number of factors. One is the fact that it is fastest growing community. It is one of the largest communities, second to Vancouver in terms of population size. We also have a large number of essential workers that are part of the community that service and provide and work in areas that have higher level of exposure. Sometimes it could be healthcare, sometimes it's other areas. We also have seen significant impact of private gatherings in Surrey. So throughout the summer, and then I think as the weather got colder in private gatherings, whether weddings, funerals, etc., we've seen larger impacts of those in Surrey as well. And COVID-19 has been proven that it is a virus that transmits in dense settings. So population density does have a significant factor. And that's, I think, another component of why we're seeing the impact in Surrey as well.
Will masks be mandated in Surrey if the infection rate continues? We've been so impressed with the regionalized approach, which we've been asking for. And today we issued a media statement on masks that it would make such a difference if Bonnie Henry actually said the word that masks are mandatory this fall and this winter because we respect her so much. What are your thoughts about that? First Victoria and then Adrian.
I was wondering who you were going to ask first, whether to myself or
over to you, Ed.
And I saw the Surrey Board of Trade statement on masking, and I also have read Dr. Henry's statement on masking and what her expectations are. She's very clear that her clear expectation is that in public places that people wear masks. And that's the expectation. She's not calling it mandatory, but that is her expectation across the board. And there are reasons why she's not calling for mandatory masking, whether because of vulnerable populations, because of medical reasons and enforcement, many reasons. I think from my perspective, there are ways that we can achieve the outcome that we're looking for, which is to have people mask if we don't have the other control measures available. For instance, physical distancing, physical barriers, people not coming to work at all if they're sick. Those are all of the things that we should be doing. And then of course, masking as well. So I think we need to look at the full picture of what we need to do, and also to ensure that we're rigorous and vigilant in all of those parameters. I believe that we've seen through wave one that people will do the right thing when we are clear on what those right things are, and whether through businesses, workplaces, many of the places do have mandatory masking, whether it's through some of the municipalities also have made those decisions. I think at the end of the day, we can get to that expectation being met, not by just one way through mandatory masking at the provincial level. There's, I think, ways that we can ensure that people are in public places masking and following that expectation without the mandatory requirement at the provincial level. I'll pass it on to Minister Dix and see whether he has additions.
Just to say that, I mean, I've spoken with Dr. Henry now hundreds of times. We're hoping that that'll be less over time. You know, not that she's not fantastic, but because we want to, obviously, we hope to need to brief the public less. I've heard her say it dozens of times. I've said it dozens of times. Wear a mask. Wear a mask in indoor public spaces. And masks are mandated in many places in BC because COVID-19 safety plans are mandated. They're obligatory for all businesses. And masks, especially in the cases where you have confined space, are mandated. In those circumstances, they're mandated because they're part of a COVID safety plan. And so it's not complicated. The debate is interesting, but in indoor spaces, when you're out in public, if you're at some sort of community place and you're moving in a public place, if you're in an elevator in your condo, if you're in your businesses, wear masks. And let's that's one element of it. But I want to be clear about another thing, though. I mean, what masks primarily do, and Dr. Lee is better to comment on this than I am, but what they primarily do is stop you from spreading COVID-19 to other people. They're not a protection device. And I think one of the concerns one has sometimes with masks is that people wearing them then don't follow the other rules. We don't mandate physical distancing, but it is our most important way to stop the spread of COVID-19. We don't mandate washing our hands, but wash your hands. Wash them twice. If you haven't washed them in the last hour, wash them again, right? Cough into your sleeve. These things are not mandated, but they are essential. If we don't do them, and masks are part of that. So when Dr. Henry talks about layers of protection, that's what she's talking about. That's what Dr. Lee's talking about. And we need to do that now. And I think it's also a sign of respect in a society. And I think increasingly will be an expectation of businesses by consumers as well within a business, right? And as we enter that period, that's important. So my answer is really simple. I've heard Dr. Henry say it many times, wear a mask.
Fair enough. Victoria, indoor fitness businesses like dance studios, spin studios, they're getting their health and safety plans approved in Vancouver Coastal, but we're seeing significant delays in the Fraser Health region, many of them members of the Surrey Board of Trade. When can they expect to reopen in the coming weeks and get their plans approved?
That's an excellent question because we've had a lot of comments and concerns. And I want to first acknowledge again that we know that gyms, fitness centers have done a great job of developing COVID-19 safety plans. We have at the same time seen some evidence of transmission that's from those indoor group fitness classes and group fitness types of activities and sporting activities. So based on evidence, the public health order specified that we are going to take a 2-week break in terms of those facilities being, it's not the full facility, it's only those classes, unless of course the facility only provides those types of classes, that we're taking a pause to develop a COVID safety plan that's enhanced and it's specific to that setting, and that will be communicated. And after that, we will be reviewing the plans. I think initially there were some discrepancies in terms of how that was interpreted, but across the board, whether it's Vancouver Coastal or Fraser Health, it's been clarified that we need to have that enhanced checklist of what we're looking for those indoors sporting activities. And after that, we will ask everybody to review their plans enhanced based on those, and we will accept the plans for approval at that point.
And just to add to that, Fraser Health is not behind Vancouver Coastal Health in any way. Both health authorities are in exactly the same spot. There was one report, I think, that took place that was not entirely accurate in that regard, but Fraser Health is not behind Vancouver Coastal Health. And what you can expect on Thursday is an update. As you know, Dr. Henry, those orders were put in place on November the 9th for essentially 2 weeks through to next Monday, effectively. And they're being reviewed now. And so you're going to see what the next steps are, probably as early as Thursday's briefing that Dr. Henry and I will be giving.
I think one of the key pieces, and Adrian, you know this when I spoke to you last week, is that when businesses are forced to shut down without any notice, if there are any government supports while they're waiting for their new health and safety plans to be approved, or at least some warning in advance would be helpful. These businesses still have payroll, they still have expenses, and these are the types of questions we're getting on a daily basis, actually, from our membership. So if there is a way towards that, if the restrictions are going to be further increased beyond November 23rd, that would be very helpful.
Yeah, and I agree with that. We had that discussion on a previous call that we were on together, Anita, and you're part of the advisory team for the government of BC and on business issues and economic issues. So that was a discussion we had earlier. But I would say this, that from the beginning in BC, we've always let the science dictate the policy with respect to restrictions. For example, in other jurisdictions, the construction industry was shut down. That's not what happened in BC. What happened in BC is it continued to be open. Such an important part of the Metro Vancouver economy, the whole provincial economy. And so we worked with the industry to make sure construction sites were safer, as safe as possible, and plans were in place. This was in March and April and May, right? So it hasn't been Dr. Henry's approach to have too many restrictions in place. When we put them in place, they're based on the science. On Saturday, November 9th, obviously new restrictions were put in place, and many people, I think some businesses were caught by surprise on it. It happened on a Saturday. And the reason they were brought in that Saturday was on the Friday of that week, we'd had 543 cases in the 2 Metro Vancouver health authorities, which is a significant increase. 7 care homes had outbreaks declared, and action was required. And this happened, you recall, in March and April. Our recollection of these things is a little bit foggy, including mine these days. But in April, March and April, when restrictions were put in place, there were a lot of questions. I mean, I can remember weeks of questions about, drive-in movies, for example, at that time. And then again in May and June, when some of those restrictions were taken away and COVID safety plans were in order. So when announcements are made, there's sometimes issues in that, and I take responsibility for that. And certainly on Saturday and Sunday and Monday, there were lots of questions coming out of that. And it's a real challenge for businesses who I think, and for people in general who are really trying, understand the importance and are trying to put changes in place and to follow them to the letter. But I guess my final point to everybody is, on every issue, if you have a doubt about something right now, don't do it. If you have a doubt about traveling, don't do it. If you have a doubt about some step or some party or some action you might want to talk about going to, don't do it. Because right now we need that kind of reduction in transmission, particularly in Fraser and in Vancouver Coastal Health.
Can you tell us, for both of you, your perspective on vaccine and vaccine distribution and the equality access to the vaccine to all populations? What's the next step when we actually get a vaccine that's we're able to use? Maybe Victoria, if you can go first.
Sure. I know that most of coverage in the media has been around 2 vaccines, one from Pfizer, another from Moderna. And I think fortunately Canada's been in the right place, because I think those are the 2 places that we had pre-ordered. So in terms of the vaccines, if they go through multiple stages, there's research step, there's preclinical trials. Both of these vaccines have gone through clinical trials, with there's phase 1, phase 2, and phase 3. and both of them have now reported on their phase 3 results, which have been looking quite promising, with 90 to 94.5%, I believe, efficacy from what they have in terms of, I think, 30 to 45,000 people that have been in those trials. So promising results so far. The next steps, each country is different. In Canada, we go through Health Canada approval of whether that vaccine can be safely approved in our country, and then post-approval, there are decisions that are made in terms of there's a national body on immunizations that approve for which context, which people, what types of people, and then there's also jurisdictional policy level discussions on how that's going to be implemented and how the allocation of the vaccines will be made. And then within BC, there's already conversations on how to allocate vaccine once we have our allotment. That'll be prioritized, usually based on vulnerability as well as needs of the workforce. So often healthcare workforce, for instance, is prioritized, as well as some of the populations that would be most impacted, such as people with chronic diseases or seniors with comorbidities, etc. So those types of decisions are made both at the federal level and then also at the provincial, territorial levels, and then with resources that also look at how we deploy those vaccines in terms of what kind of settings do they need to ensure that they're safely provided to those that require them. So, there's all types of ways to provide a vaccine, whether it's pharmacy, whether it's public health, whether it's family doctors' offices. So all of those discussions are occurring right now to look at pre-planning ahead of when the vaccine is available. And Minister Dix would know more about where we're at from provincial perspective.
Yeah, and that was pretty comprehensive answer. I'll just add that obviously there are three key elements that will come into play. I mean, how much vaccine we get early and the nature of the vaccine. There may be vaccines that are not best provided, for example, to our elders for a whole variety of reasons that are medical. And so those recommendations will be important. Secondly, there are some challenges with these vaccines, which, by the way, have not been independently reviewed. Right, not been independently reviewed. So what we're getting is very optimistic and positive information from the two companies, and we'll have to take a look at that because safety is really important. But you're going to see before the end of this year, really, the ethical framework that we've had talks with the federal government about, that our public health leaders are leading, that will define who gets the vaccine first. It would be our hope that everyone by this time next year would have had full access. Everyone who wants the vaccine in BC will have full access to it. The initial stages will be the kind of priorities that Dr. Lee has talked about, for example, healthcare workers and others. But if, for example, we had in a $5 million person population, 300,000 doses of vaccine, that would have a positive overall effect on transmission for everybody, those that get the vaccine and everyone else. So those priorities will be set out and laid out and made public so that everyone understands what the order of receiving the vaccine is and why.
Adrian, as you know, Surrey is a border city. We're a trade gateway to the United States. The border closure is set to expire, I believe, on November the 21st. What's your perspective on extending that border closure or reopening the border?
I think we have to extend it well into the future. I mean, look, we're in Canada and we have an open view about our own country. And even though British Columbia, even though we see high levels of transmission and mortality in neighboring jurisdictions in Canada, we won't be taking measures on those borders, although we are encouraging people to avoid non-essential travel. With respect to the United States situation, I think the current ban on visitors has to continue for certainly months into the future, in my view. It's very challenging for many people. I mean, it should be remembered, I think, and businesses in Surrey will understand this, that disproportionately people working in the Fraser Health Authority are the essential workers going to the United States and bringing to our country, for example, and bringing to our country and to our province and to our cities the essential goods, especially food that we need right now. So one of the reasons why Surrey is disproportionately affected by the pandemic is because it has a disproportionate number of essential workers in all fields, and so we have to understand that. But I think that the current border restrictions need to be extended. They need to be extended into the future. It's very challenging for some communities, and we've heard, for example, for Point Roberts and other communities where in the United States where it's very challenging, and for individual people. You know, I think it's always been a rite of passage for people every year to go to Seattle. It's the closest, you know, big city to Metro Vancouver, and people go there all the time. There are people living in Surrey who went to border cities many times a week to shop and there are people who live on both sides of the borders. Dr. Lee will tell you there are healthcare workers who live on both sides of the borders who've been affected to work here but live in the United States. So all of these effects are profound, but we need to keep the current restrictions in place for a significant time into the future. And British Columbia has led on this question in ensuring that people who do come back to Canada, Canadians who return to Canada, do their 2 weeks isolation. And that has to continue to happen as well. We just cannot be taking risks and chances in these times. And it is without question that our situation in the spring would have been dramatically worse, and our situation now would be dramatically worse if we didn't have those border restrictions.
Adrian, just out of curiosity, why is air travel allowed? So Americans coming into Canada by air, shouldn't that be restricted?
Well, it is. I mean, I could get you the numbers. The airport authority can get you the numbers, but it is in both places, right? So non-essential travel is restricted in both places and in both ways. And you know, there are Canadians who have found ways to get to the United States and then are able to come back. But if you look at air travel through YVR, it is so dramatically lower than it would be normally, like in the tiniest % lower on international travel. There are, and we see these international flights, and we see the exposure warnings that sometimes come from those flights, both domestic and international, but there are relatively few flights right now, and they principally involve either essential workers or Canadians.
Victoria, what is your advice for this Christmas season, New Year's, this upcoming holiday season as people go to shopping centers and shop? Are there going to be additional restrictions? How can we gather?
Yeah, I think kind of goes back to what we had started with Minister Dix's comment about where we're at right now and our alarming and concerning trend that we have seen. And with the public health orders in place, we're closely monitoring what the impacts of the public health orders and compliance of those orders look like right now. And as Minister Dix mentioned, there might be more information coming up as early as Thursday. I think that we have to really look at how we gather, how we interact with each other right now. We had a lot of messages about Diwali just in the past weekend on, you know, celebration of lights. Usually we all gather together as a family with extended families, with many others in our community, and celebrate in person, regardless of what the public health order looks like. The COVID-19 virus is going to be with us for some time, and I think we really have to look at creative ways of celebrating without that physical gathering, and whether it's virtual, whether it's through you know, places of worship, whether it's in safe places. I think we will need to continue to reduce our social interactions with where we're at right now with COVID-19. So I think we should still celebrate. We should actually challenge each other to find creative ways to do things. And I've heard wonderful stories from our communities and culturally diverse groups on how they've come up with different and new ways to celebrate together, but physically apart.
Adrian, any comments on that?
just that this is going to be a different Christmas than ever before. I was telling people on Remembrance Day, my wife Renee was an award winner from the Surrey Board of Trade, so I got to throw that in there. And very much part of Surrey life. But we went outside on Remembrance Day, outside in the park in front of our apartment here in Collingwood neighborhood of Vancouver, and just stood before 11 o'clock, and there were people in different parts of the park, families who came out and did the same thing, well, I find Remembrance Day ceremonies unbelievably moving whenever I go to them. This was very moving as well to see people do that. And we're going to celebrate Christmas differently this year. We just are. And part of that celebration, though, it seems to me, if we live in Surrey, or we live in Delta, or we live in Vancouver, or we live in Cranbrook, should be to find ways, in safe ways, to support local businesses in this time. I don't want to say anything about Amazon or anyone else, but I think part of our thing, we can find ways to do that, delivery at door and other ways to support local businesses. And this year especially, with all the challenges facing the business community, we should be shopping locally. We should be buying books locally. We should be buying gifts locally and toys locally, and finding ways to do that. And I know businesses are showing imaginative ways within their safety plans to ensure that people can shop in local businesses. This is the year to do that. We should make that part of our Christmas commitment to one another, that we support local business in a time when local business has been stepping up for people and communities as well.
Absolutely. We echo that across the nation in our Chamber of Commerce Board of Trade network of 450 organizations. There's many questions yet to answer, but we're going to send them to you after the session is over.
Sure.
And to our audience participants, we will get back to you with the answer. Any closing remarks, Victoria, and then Adrian?
Did you want me to start, Minister, or would you like to?
Yeah, go ahead. Go ahead.
Thank you so much for all of the participants of this call, and also Anita for your leadership as well. It's been wonderful to partner with you to rapidly communicate and extend our messages to your members. And again, I'd like to take the opportunity to acknowledge all of the good work as well as partnerships to date. And we look forward to working closely with all of you to ensure that we bend the curve again. And I'm sure we can do it again. We just need to do it all together.
Thank you. Adrian.
Hey, just thank you to the Surrey Board of Trade, to Puneet, to Anita, and to Councillor Pettigrew, who's on the call, Councillor Annis, my friend Councillor Locke, I think, is on the call, and of course my colleague Harry Baines. Thank them, and thank the City of Surrey for their really continuing and support for our efforts in dealing with COVID-19. We're very proud of the work we're doing with the Board of Trade, but also with the City of Surrey to deal with the situation facing the community. This is an important time, and I ask everyone to look at ourselves, to look at the orders that have been put in place, to look at our COVID-19 safety plans, and really step up in the next little while. We can do this together. We've shown that before, but it requires health system action, community action, but also individual action. And I ask everyone to be what the Surrey Board of Trade is and what the business community is in Surrey, I believe, which are leaders in ensuring that we flatten the curve again, and we do it for the ones that we love, our family and our friends, and the ones that we don't know as well.
Thank you, Adrian. Thank you, Victoria, for your time today. And ladies and gentlemen, thank you so much for attending. On behalf of the Surrey Board of Trade and the South Asian Business Association, make it a great business day.